Good morning. This is an interesting topic. When your doctor tells you your cholesterol looks fine, your LDL is not very high, your HDL looks good, and ultimately your triglycerides are normal. And so you assume the risk of heart disease is definitely low based on what your doctor tells you. There is another blood test that many people have never had done or they never got it done. It's called lipoprotein A. Some people call it LPA. And this is interesting because lipoprotein A is determined by our genes. And generally speaking, you inherit it from your parents. So let me explain what that really means. First and foremost, LDL or low density lipoprotein or the bad cholesterol is technically a particle that carries cholesterol through your bloodstream. So think about LDL like a small pickup truck that carries cholesterol. If you have too many of these particles for years, cholesterol can accumulate in the walls of your arteries and contribute to plaque formation. But LDL levels are influenced by many different things. Your genetics do matter, and so does your weight, your physical activity, your diet, your other medical conditions, and etc. So now imagine taking an LDL like particle and attaching an additional protein to that. Now you basically have apolipoprotein A, which is a combination of the LDL particle plus apolipoprotein. So, uh, why is this so important and why am I talking about it? Is because this leads to a structural difference and it contributes to plaque formation in arteries. And then the plaque formation in the arteries quite often leads to inflammation. It is involved in blood clotting, which I have to treat quite a lot of in form of deep venous thrombosis or pulmonary embolism. In patients, it increases the risk of aortic valve stenosis, uh, and in some instances, it narrows the valves that basically are supposed to move blood through the heart. And so the genetic part of it is quite fascinating because uh, the amount of your lipoprotein A is controlled primarily by a gene called LPA gene, and you get in or you inherit copies of this gene from your parents, and different people inherit different versions of the gene. One particularly important difference involves how many reported uh, studies have been done about it. And when you actually read all the studies, you realize that uh, the actual gene could be repeated over and over again. So there are what we call Kringle 4 type 2 repeats, and they do not need, I mean, you really don't need to remember that. I'll write all this out. But here's what you really need to remember is that the genetic version of what you inherited can strongly influence how much lipoprotein your liver produces. And some people inherit genetics that results in very little lipoprotein A, and other people inherit genetics that leads to much higher levels. And because of that, there's a huge difference fundamentally in whether or not you struggle with heart disease or not. Now, that doesn't take away from eating healthy, not smoking, not drinking, being active, lifestyle things. We can't get away with them. So what I want you to take away from this is number one, lipoprotein A is not normally included in standard cholesterol panel. So when you see your doctor, please ask them, in addition to your HDL or happy cholesterol, LDL, sad cholesterol, triglyceride, what is your lipoprotein A level? And that's going to give you more ammunition to take care of yourself because then you know the genetic aspects of it. And recently, this is included in our lipid panel. But if it isn't, just ask your doctor and they'll be happy to do it. Ultimately, all we want to do is keep you healthy. Pay close attention to your blood pressure, smoking, weight gain, exercise, and your overall health. But now we have this other test called lipoprotein A. That's if you hadn't heard about, now you have, and hopefully this is going to help you stay healthy and away from doctors for a lot longer. I wish you the best of luck, and make sure you get your lipoprotein A checked, and hopefully we can keep you alive and well for a very, very long time, and you won't have blood clots in your legs or your lungs and other places, and you won't have to see me. God bless. Have a good day.